was what I had to do, go to the emergency room and pay the bill somehow, some way.
Wait, how do you have health insurance?
How do I have health insurance?
Yeah.
I pay for it.
So is it through your employer?
Through the state. I'm also on Medicare.
The Trump administration wants to defund it. Yes.
Right. I don't believe it. There's no evidence of that.
Well, he did it already. The big beautiful bill defunds Medicare.
Oh, really? That's why I'm still on Medicare.
Yeah, it's gonna defund it after the midterms.
Really?
Yeah.
Okay, we'll see when that happens. Because I'm still paying for the service. It's not free.
I'm aware. I mean, but
They
yeah.
take it out of your Social Security check.
I want you to get Medicare. I want people to get Medicaid. I want you to be able to live in dignity for the rest of your life. And the Trump administration is actively trying to defund the things that you need to live.
I don't believe that.
And it's going to kick in after the
believe
midterms.
I don't buy that, and we'll see what happens. You're looking into the crystal ball.
I'm
going to
put like a little blurb right here showing what the big beautiful bill defunds. Basically, it's going to go right here.
Right.
So
you can prove that I'm ignorant, but that's okay.
It's gonna go right there.
I don't believe you. I don't buy it. I know you're a left-wing liberal, and a lot of things you say are kind of like slanted.
How about this? We see each other at MAGA events repeatedly. Right. Can you make a commitment that you're going to look that up?
I certainly will.
Once you've looked that up, you can come back to me the next time you see me.
Yes.
And you can say, hey, I looked it up. Let's go over the nuances of that, right? And then we can have a proper discussion on that.
All right.
Thank you.
Walter, it's been a pleasure.
So Trump just said that it is impossible for him to take care of Medicare, Medicaid, and daycare. MAGA is so fucking stupid, okay? He is taking all of our money. He's taking every last dollar of the federal government, and he's giving it to himself and his friends. He's cutting Medicare and Medicaid from the federal government. Watch. That's what he's telling us. And he doesn't believe in affordable daycare. So every time they want to force a woman to have a freaking baby that she doesn't want to have, and they want to tell people to have kids they can't afford and then yell at them when they can't afford to feed them, this is what he's doing. He keeps telling us out loud. And I cannot believe that MAGA thought for 1 second that he was going to do anything to make our lives better. He's stealing our money every single day. And it's only going to get worse. He's now having our sons and daughters in a war, losing their lives. So there's that. You MAGA, you suck. I cannot stand you people. You fell for it. We told you. You could not be more stupid.
Fuck this whole goddamn administration, dude. I just got my healthcare taken away from me. I'm a 100% disabled veteran. I got a partial part of my fucking healthcare taken away from me because of fucking Donald Trump and his goddamn cronies. Thank you. Thank you so goddamn much. Thank you. I'm gonna be in fucking pain for weeks again because I can't get the goddamn healthcare that I need. They took away my fucking healthcare. Are you listening yet? They don't give a fuck about American people. They don't give a shit about veterans. They took my fucking healthcare. I'm a 100% disabled veteran and they took my goddamn chiropractor, you guys. The only thing that gives me relief for my broken back. The only thing that gives me relief. They took it away from me. They say I live too close and now community care is no longer available to me. Even though the VA is so understaffed, they cannot get people in when it's actually necessary. They can't get people in because they're so understaffed. Thank you. Thank you so fucking much for voting for this shit. Thank you. Thank you. I hope you have fucking veterans in your family that shame on you. Shame on the MAGA people. Shame on this goddamn regime. Are you fucking serious? I can't get my goddamn healthcare, but billionaires can get more fucking tax breaks? Awesome! That's fucking awesome!
I saw this circulating yesterday and I wanted to look into it before I shared it. So here you go. If you are on Medicare or on a fixed income, I just need a couple minutes of your time. I'm actually sick to my stomach after reading up on this bad news. And this is bad news that's going to hit your wallet come January 2027. This is an attack on seniors. The Trump administration announced they're going to cut a Medicare Part D subsidy program. This is absolutely abhorrent. This is devastating for millions of seniors who are on fixed incomes and who are struggling as it is. Experts are saying because of this administration's decision to cut this program, private insurance companies are going to hike up their monthly premiums. They're estimating 45% of our seniors are going to face premium increases in January. And if you've ever struggled a time in your life, trying to make that dollar stretch is between life and death. But I should clear something up so that there's not a mass panic. They're not canceling the overall Medicare Part D. That $2,000 annual out-of-pocket drug cap, it's still there. Your medications will still be covered. It's the monthly premiums that will increase. The subsidy program is what they're cutting. Like I said, this doesn't hit until January of 2027. So if your income is limited, apply for Medicare's Extra Help program right now. When open enrollment hits, go and find the cheapest plan in your area. And I just saw that some states have state pharmaceutical assistance programs that will help pay premiums for you. And just a reminder, Dr. Oz and his team has cut this funding because they've stated that market conditions have stabilized. What? These are our seniors, the people that we're supposed to take care of. What exactly are you guys going to do with that $3.6 billion funding if you're not going to give it to the seniors?
Medicare is one of the most important programs for millions of older Americans. So when changes are proposed or funding is reduced, it immediately raises concerns about healthcare costs and access to care. The question is, are recent Medicare changes improving the program or leaving more Americans worried about their healthcare? Let's watch more clips and we'll come back to that.
So do you know what Donald Trump just did to the very people that put him into office? See, if you're on Medicare, you have parents or grandparents on Medicare, you're going to want to hear this because what the Trump administration just announced could end up costing some seniors who again voted for Donald Trump more money for their prescription medication coverage. And that's the thing though, should we even care? Because it's affecting the people that literally put him into office. They voted for this. So here's what's going on in case you don't know. See, the Trump administration announced that it is ending a temporary Medicare Part D subsidy program in 2027, which many people don't know what the heck I'm talking about because they haven't heard about it. So let me tell you, this program was created to help keep prescription medication insurance premiums from jumping too quickly while Medicare's new medication pricing was being rolled out. So in other words, the federal government has been helping stabilize costs, and now that help is scheduled to end in 2027, which is next year. See, the administration says that programs like these were always meant to be temporary, then taxpayers shouldn't keep footing the bill forever. And critics argue that once those subsidies disappear, most Medicare beneficiaries could end up paying higher premiums depending on how their insurers respond. Now, supporters say it's the right move because temporary government programs shouldn't become permanent. And opponents, of course, say that seniors could be the ones that are going to be paying the price. But see, here's the bigger question. Is this responsible spending that finally ends another temporary government subsidy? Or is it a decision that could make prescription medication coverage more expensive for millions of older Americans, along with the price of gas and food, of course? See, one thing is certain. If you or someone that you love relies on Medicare Part D, this story is definitely worth paying attention to because the effects won't be felt tomorrow necessarily, but they are going to be felt in 2027. But again, should we even care since this is exactly what the seniors voted for?
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends.
This is quite literally what you voted for. Why are you so confused? You voted for the man that wanted to take away Medicaid. He took away the Medicaid, and you're shocked? You can't afford your medicine? Oh, don't worry. I'm sure that Doge check's still on the way. I do not care. I legit do not care about any of these people. They voted against their own interests. They voted against themselves. Why should I give a fuck that he can't afford his medicine? He should have thought about that before voting for the candidate that wanted to make it so he couldn't get it. Call me selfish, call me heartless. I really don't care. These people fucked around and now they're finding out. I don't care. And the thing is, they don't regret voting for Trump because Trump is a bad guy and he's hurting people. They regret voting for Trump because now they are being affected. When Trump was only affecting the brown people, they were like, yeah, fuck yeah, Trump, woo! But now that it's starting to affect them, now it's like, oh, wait a minute, I didn't vote for this. Yes, you did. You sure did. So I don't know what you expect people to do. Maybe call your president. Maybe your president could call his little billionaire friends and they can help you out. Because unfortunately for you, all I have to give are concepts of thoughts and prayers.
You didn't get a wall. You didn't drain the swamp. You didn't get affordable health care. You didn't eliminate the national debt. You didn't get new infrastructure. You didn't get Hillary Clinton locked up. You didn't get Epstein accountability. You didn't get a $5,000 Doge check. You didn't get a $2,000 stimulus check. You didn't get lower grocery prices. You didn't get help buying a home. You didn't get America first. You didn't even get peace. You lost family, friends, and credibility. So what did you gain?
Healthcare has long been one of the most debated issues in American politics. Supporters of President Trump argue that changes to Medicare are intended to reduce waste, improve efficiency, and strengthen the program's long-term financial stability. Critics, however, argue that some policy changes could reduce benefits, limit access to providers, or increase costs for certain beneficiaries. Exactly how these changes affect people depends on the specific policies being implemented and how they are being carried out. For millions of seniors and Americans with disabilities, Medicare isn't just another government program. It's the difference between receiving needed medical care and delaying treatment because of cost. That's why even relatively small policy changes can have significant real-world consequences for patients, families, doctors, and the healthcare providers. Regardless of political affiliation, most Americans share the same priorities: reliable healthcare, affordable prescription drugs, access to doctors, and confidence that Medicare will still be there for future generations. So what do you think? Should Medicare reforms focus primarily on reducing spending, expanding benefits, or finding a balance between the two? Share your thoughts in the comment respectfully, and before you go, do well to like and subscribe to my channel. I'll see you in the next.